Next, we have Ms. Robyn Sunday-Allen, the Vice President of the National Council of Urban Indian Health in Washington, D.C.
Good afternoon, Chairman Schatz, Vice Chairman Murkowski, Senator Langford, and members of the Senate Committee on Indian Affairs. Thank you for the opportunity to testify today. I am Robyn Sunday-Allen, a citizen of the Cherokee Nation and currently Vice President of the National Council of Urban Indian Health, which represents the 41 urban Indian organizations with 77 facilities in 22 states. UIOs provide high-quality, culturally competent care to urban Indians, or over 70% of the American Indians and Alaska Natives living off reservation. I am the CEO of the Oklahoma City Indian Clinic, a UIO that provides comprehensive health care to over 21,000 Native patients, representing over 220 tribes. I would like to thank the committee for working tirelessly to help equip the Indian health system with essential resources. I testify today in support of the Urban Indian Health Providers Facility Improvement Act, S. 1797, which will expand the use of existing Indian Health Service resources under Section 509 of the Indian Healthcare Improvement Act. This legislation would enable IHS urban Indian health dollars to be spent where they are needed, including for necessary facilities, maintenance, and renovation. I applaud Senators Langford and Padilla for introducing this bill that will fix an unnecessary barrier to care and allow UIOs to make critical updates to our facilities. Specifically, this bipartisan bill corrects an oversight in Section 509 of the Indian Healthcare Improvement Act that effectively prohibits us from using our IHS funding on infrastructure and facilities improvement projects unless the project is undertaken for accreditation by the Joint Commission. TJC is no longer the applicable accrediting body among the vast majority of UIOs. 40 of 41 UIOs do not utilize TJC accreditation. Since 2004, at the Oklahoma City Indian Clinic, we have used Accreditation Association for Ambulatory Healthcare, AAAHC, a nationally accepted accreditation body. IHS promotes AAAHC as an option for UIOs and even regularly holds AAAHC training for UIO staff. However, AAAHC accreditation effectively bars Oklahoma City from utilizing IHS funds for any facility improvements because the statute only mentions TJC. Ultimately, this restriction impacts the provision of services to our Native patients. For instance, during the COVID-19 pandemic, UIOs were unable to use IHS funds to make critical facility renovations to safely serve patients despite the immediate need for updates like transitioning to telehealth, air circulation updates like negative pressure rooms, and air purification systems, in redesigning or adding space to allow for social distancing. One UIO could not use its IHS funding to purchase a new HVAC system. In other words, a health facility could not use its funding from a health agency to make air purification changes amidst a global pandemic of an airborne virus that could kill its patients and staff. Solely because of this restriction, this bill seeks to fix. At Oklahoma City Indian Clinic, we have been forced with difficult decisions, at times having no choice but to divert revenue from patient care to meet the critical infrastructure needs essential to continue serving our patients. As a nurse administrator, I am aware of what healthcare looks like in a well-maintained medical facility. Inadequate facilities and safety issues are never something I nor any other UIO want impacting the care we give our patients. We are in a race against time and we need this legislative fix now. This bill would remove this prohibition, immediately allowing UIOs to use their IHS funding more effectively and efficiently. This bipartisan bill has widespread support, including within Indian country. For example, NCUIH and 29 Indian organizations included it in an infrastructure needs letter to Congress. In addition, the National Congress of American Indians recently passed a resolution in support of this fix. It also has wide support among policymakers, with House Interior Appropriations including the UIO facilities fix in its FY22 bill and the President's FY22 budget, similarly including it, also noting it has a 0 score. All this support makes one thing clear: we must act now to pass this urgent and no-cost legislative fix. Finally, this issue is urgent and ripe for resolution, with the Senate considering the largest infrastructure framework bill in history. We respectfully request the inclusion of this bill in this infrastructure package. We respectfully urge the members of this committee to include S 1797 in bipartisan infrastructure framework. In addition, we recommend the committee hold a markup on this bill as soon as possible to allow for floor consideration. Finally, we ask all members to co-sponsor S 1797, and thank you to those that have already taken this important step. Again, thank you for your time today and for working with the NCUIH as we ensure American Indian Alaska Native people receive high-quality care regardless of where we live.